including the United Kingdom. And we're doing some very specific work with 2 generations in both Los Angeles and New York. And it's catching hold and becoming a part of the work across our entire Friends of the Children network. And so we'll begin with a little introduction to the work in New York. And then I'll give you a little brief about what we're doing here in Los Angeles. And Gary and I are gonna go back and forth on a couple of very important issues about how this work looks on a macro and micro level. And then we will finally open it up for the last 20 to 15 minutes for a little Q&A. There's a lot of great minds in here, and so we want to make sure that we don't gloss over some of the ideas and thoughts and questions that you may have. So to get this started, let me kick it over to Gary. Gary, I want to tell you again, thank you so much for joining me. You've been doing a lot of these kinds of conversations with important people in the Harlem and Bronx area of New York. You've also been with Friends of the Children for a little more than 10 years. You know the model, you know the work. Many of the executive directors from across the country come to you for support, guidance, as well as wisdom on how to make sure that we are doing the very best by the children that we serve. So if you don't mind, I'd love for you to introduce yourself to our group and let them know why it's important for us to adopt a 2-generation framework. And thinking, and as you talk about that, I'd love for you to talk about how, when you first came into the Friends Network, you were doing it in one particular way, and now how it has evolved to where we're now focusing on both child and parent.
Yeah, no, thank you for having me, Thomas. Yeah, no, this is a pleasure to sit down and talk to you about some very important issues. I consider you a friend also, so thank you for having me. So yeah, no, I joined Friends in 2008 as a friend, and I think the model has always been to really target kids that have been impacted by systems, so have been the most marginalized kids that in our communities, and give them this paid professional mentor for 12 and a half years, starting between the age of 4 and 6. And so, we've done that work for the last 27 years. But when I was first starting to work with kids, with all my boys, I was doing great work with them, but I quickly realized that the parents were also part of the equation as well. So even though I was working with the boys and we were enjoying, we were having great outings, but whenever the kids need mental health resources, or if they needed more supports in schools, I know I had to sit down and talk to the parents about how we can partner together and collaborate and help support their child. And so for me, I think I went in this work really, thinking I was going to work with just the boys, but then I realized that it was going to be, the family was going to be just a major part of my work as well. And actually, Annie E. Casey did a study on us about 4 or 5 years ago, and they found out that we were having impacts on the parents as well. And so, as you mentioned, both here in New York, we implemented that. In LA and New York, we implemented that. And so in New York, what we're doing, we're looking for kids that have aged out of the foster care system, and now they have their own kids between the age of 4 and 6, and giving them this mentor for 12 and a half years. So the families have one mentor that they're working with, but then also we're not only working with the kids in foster care, we're also working with kids that have been impacted by the criminal justice system as well. So people that have recently just been released or on probation that have a child between the age of 4 and 6, we're also giving them this 2-gen mentor as well. And we're just seeing that it's just so important to help, like I said, the family and the child, but it's also important to help the family. So.
Thank you for that, Gary. No, just to piggyback off of that, just so people have an understanding of how Friends of the Children Los Angeles came to be. In 2018, the National Friends of the Children organization was able to get some really great catalytic support from the Conrad and Hilton Foundation to launch our work here in Los Angeles. And that was to focus on foster youth that are currently parenting here in the Metro and South LA section of Los Angeles County. And where that made so much sense to me in all my years of working with children that have been impacted by foster care is that it just stood to reason that you can't think that you're going to help create the conditions for change with a child if you don't stay mindful of the needs of the parents and the entire environment. Even though our model allows us to be in the child's space for 4 hours a week or more in the school as well as the classroom for 12 plus years, a child is always going to be in the presence of the family, much more than just us. And we needed to be always mindful of some of the challenges that families face. And so, you know, it's interesting when I think about this moment in time in history that we're currently in, when we think about how COVID-19 is impacting communities and regions across the country and the state of crisis that many people are in, of course, a lot of these young parents that we began to serve back in 2018 were already in a state of crisis. And so COVID-19 has only exacerbated the problem even more. And, you know, as I talk about this, I always want to give people a chance to see things visually. And so I'm going to share my screen with you all just so you can get a sense of what this actually looks like in real time. So let me show you just a quick visual. There we go. So when Gary and I are talking about two generation, there's two philosophies that go into this. There's a parent-focused philosophy where you focus on the parent and then you tend to the child in an ancillary way. But our work at Friends of the Children is really child-focused. We spend the bulk of our time really providing intentional, time-sensitive, high-dosage levels of support to children beginning at the tender ages between 4 and 6. And like I said, we stay with them and work with them consistently all the way until they graduate high school. And the two-generation component of this is, again, paying close attention to issues of early childhood development, attachment and nurturing between child and parent. We're also thinking about parenting skills, like I mentioned earlier, Gary. Gary and I are working with largely in our regions with former foster youth that are on the young side of things between the ages of 20 and 26 years old. And so when it comes to having lots of great examples and training and building healthy and strong and resilient kids, they haven't really had an opportunity to take time out to develop those philosophies. And so they're learning it on the fly. And of course, and as they grow and not only fight for the empowerment of their children and managing a tough LA economy, they're also, you know, wrestling with their own experiences from the past traumas, as well as, you know, being individuals who are trying to grow and thrive on their own. And so when we think about the work that we've done in COVID during this time of COVID-19, the other component that we have to think about are some of the basic needs that many of our children and families are doing without. You know, they have to compete with the masses of folks that are out in these markets and buying up the stores and hoarding food and essentials for themselves. And they have to take the dollars that they've been able to pull together from their jobs to be able to make sure that they have all of the necessities for their children and themselves. And so our two-generation work is not only, you know, making sure that we're supporting the child, but it's also during this moment in time, making sure that parents have help when they need support with childcare, support with housing, support with finding jobs. And of course, as we know, as we see the impact of COVID-19 on the entire country, that employment is going to be a major component of our work and how we get them connected and paired with the right services and supports that can help them really get back on track. And then of course, there's the element of health and well-being, and that has so many different components to it and nuances that this is more important than ever. And so as you think about that particular cog in this matrix, that the mental and physical health and behavioral health are all critical elements of our work. And of course, making sure that as people are getting kicked off of their healthcare systems, as people are losing their jobs and being furloughed, of making sure that our parents keep their access to Medi-Cal and get the support that they need. So those are just some real elements that we've been focusing on. Some of you, if you've been paying attention, we've been doing, New York as well, doing bi-monthly grab and go events where we're providing parents with gift cards and food and water and all kinds of other basic essentials and as well as rides to and from places to make sure that they get what they need in order to support their children to get through this moment in time. And that's one of the very important pieces of our two-generation work that really makes this work. And where we've grown in a short amount of time is that the Los Angeles County, about a year ago, recently awarded us a sizable contract to expand our services in another very important region of Los Angeles County, which is the Antelope Valley region. That's the Palmdale-Lancaster area, which is about 80 miles north of the city of Los Angeles. And we're there now enrolling children and doing it all remotely and providing the same level of support for those children and families to children who have already come in contact with the Department of Children and Family Services at least one or more times in their young lives. And so again, we are applying our two-gen model as we scale in multiple regions across the county in order to really make the kind of impact that we want to see. And so that just kind of gives you a little snapshot of what we're doing on both coasts and how we're trying to make a difference. And so one of the things I'd love to do, Gary, if you don't mind, when we think about LA and New York, a lot of people don't know this, but Los Angeles and New York combined, Los Angeles has the largest child welfare system in the country. New York has a sizable foster care system too. But in the last 10 years or so, they've been able to contract quite a bit and shrink their foster care system. Can you give us a sense of what's happening in New York for them to be able to do that? And maybe there's some lessons to be learned for us here in LA.
Yeah, I think about 15 years ago, they put together a commission because they found that there was a lot of disparities in the foster care system. So they found out that Black and Latinx families disproportionately being represented in foster care system. So they really did some self-reflection and really figuring out, why that was. And they found that, that certain communities, kids weren't growing up in a community that they necessarily were born in. So what they did on that self-reflection is really that always, child welfare is always meant to keep kids safe, but they said, how can we also help families thrive? And they found out that, through research that, kids do best when they're, either when they stay at home or when they can stay with a family member. And so they kind of adopted the culture of they're going to do everything they can to try to keep the child home while keeping the child safe. And so what they did was make sure the first step, if a child couldn't be at home, is to look for family members to do kinship care. And then if not that, well, also with that, it's also put in preventative service as well. So about 15 years ago, there were about 55,000 kids in foster care. And now that has been reduced to about 9,000 kids. And so they have each family, when a call is made or when something happens, something kicks in where now they offer a lot of preventative services to that family. So they offer services of housing services, professional mentor, some call it a coach here, and a variety of resources, whether it be financial assistance, all those type of things that really keep the child at home while helping the family thrive. And they found that they have the same, the kids are not less safe adopting this attitude, adopting this, and they're looking to even grow their preventive services even more. So I do think this is something that the country should learn. I think prior to 15 years ago, the focus was very punitive, kind of the first, when they felt a child was in danger, their first reaction was to take the child away. But they really have thought about that and think about it in a very different way. So yes, we want to keep kids safe, but then we also want to figure out how we can keep this family thriving, like I said, and to do that, they realize they need to put in preventative services.
For sure. In Los Angeles, there's a lot of conversation happening right now about reimagining foster care. Because we've had a huge system, the biggest in the country for decades, as we start talking about how things need to be transformed and reformed or absolutely blown up and remade again in a better way, a lot of that conversation has been about our child welfare system. And as I hear some of these conversations, the thing that comes to mind for me often is that everything is connected to everything. And as much as we would love to change the foster care system, we also have to understand how other systems also come into play and impact it. How the criminal justice system has a role, how the workforce development system plays a role, how public assistance and public health also play a role, and how each one of those systems somehow feeds into the foster care system. And so there's no quick and easy way. And I will say a real bright spot in this moment in time is that our local Los Angeles County Board of Supervisors just this past July 19th, began a debate on adopting a racial equality platform that would be built into the county plan. And it would make racial inequality a public health issue for the first time in the county of Los Angeles. And I think this is a huge step. And it was initially proposed by supervisor in a district where we serve a lot of children, Mark Ridley Thomas, to bring this forward. And if passed, it would make Los Angeles County the 24th county in the United States to adopt a racial inequality platform and start to take measures to do something about it. As much as, and I think that's a great, great sign of hopefully things to come. But just to let you know how big this hill is, in the country of the United States, we have 3,141 counties. And so we would be the 24th. So there's still plenty of work to do. So everybody that's on this call listening, just know that I'm going to put a little bit of burden on you to help make sure that more counties get involved in this regard. I think the other thing I think is important to note in terms of trying to change the way we're thinking about foster care is, again, I'm going to reference the work that we're doing in the Antelope Valley region. That is also through some stimulus dollars and support from our Los Angeles County Board of Supervisors to think about foster care differently. Instead of hoping and praying that children don't end up in foster care, let's pair them with a mentor and provide them with the supports they need. Let's help empower the family even more so they can make sure that they take all the necessary steps to keep their kids at home and not in the custody of others. I think those are the beginning steps for us reimagining the foster care system and doing some early intervention preventative work. And I think those are really great signs. And I think for me, I know in running the LA chapter, the goal is to find more pathways to expand that model across the county. And as we talk about this, Gary, one of the things I know that you and I like to talk about, we like to be soft on individuals and tough on systems. And so if we're going to talk about equity, love to talk about equity in the terms of how issues of these disparities that we deal with, that we see on a daily basis, and some of the racial inequities that we see on a daily basis, how they can be addressed on a macro and micro level. And so starting with the macro side of things, when you think about policies and systems, what comes to your mind? And I'm going to leave it open-ended for you to go any direction you want to go when you think about the larger systemic component of this.
Yeah, I think before you ever jump into a solution, you have to understand the problem first and foremost. And I think to understand the problem, you do have to go back to history. And if you go back to history, in history, you have the era of mass incarceration. Before that, you had segregation. Before that, you had Jim Crow, and before that, you had slavery. And a lot of people separate, a lot of people maybe think oh, these were those people over there thinking about these, that were doing these things. But no, these were United States of America policies that it was illegal for a black man to be free. I mean, you had to be a slave if you were going to be here. I mean, so I think the reason why I bring up the history, you got to say, well, why did these things happen? And these things happened because we had a lot of racist ideas that we had, and that created racist policy. and just kind of going back, I went back all the way to slavery, but kind of coming back to here where we're still in the era of mass incarceration. When you think about why we adapt, racist policies, is that racism always is going to mutate. It always, regardless of, it's always going to change. And where we are now, we're at a place where we demonize a certain piece of people's cultures. And what I mean by that is you hear things like thugs, you hear things about like welfare queen, crackhead, you hear terms like that, and that's meant to dehumanize people. So when you do that, people feel like these people are less than, and so we have to create policies to kind of keep these people in check. So I think the first piece that we always need to think about is, when we do think about policies, why are we creating these policies? What are these policies meant to do? Are they really meant to keep people safe? And is that really going to happen? Or is it meant to are we creating policies off of fear for something? So for me, it's always thinking about it in that way. So that's one piece when you talk about the policy. But the other piece, I think, when you change policies, when you realize certain policies weren't effective or disproportionately affected people, a lot of times we don't put any type of retribution or any type of things to help on past trauma that people experience. So if you go back, after slavery, nothing happened for Black people. After Jim Crow, nothing really happened for Black people as far as like supportive services. After segregation, nothing necessarily happened. We changed policies, but nothing really happened. And then we're in mass incarceration now. And so I think when you think about when we change policies, you also have to build into those policies supportive services. What supportive services are you going to offer? So if you think about marijuana, for instance, I know on the West Coast, Oregon, Washington, California, marijuana is legal. So they legalized marijuana overnight, but they didn't necessarily think about, well, how many families have been damaged on how many people to be locked up for marijuana, and what are we going to do to help those people? Because now we realize marijuana is not as bad as we thought. It's legal now, but a lot of people spent 5 years, 10 years in jail for marijuana. Should we give supportive services to those people? And to me, I feel like we should. So I think anytime a system has traumatized groups of people, we should offer supportive services to them. And I think that's where I'm so passionate about this model, because I feel like this model, the reason why you need a 12-year model, a 12-year intervention, is because when generations have been traumatized by certain systems, you need to offset that and get them supportive services so they can get back on their feet. So to me, that's kind of at the macro level. I think at the micro level is when you're engaging youth or families, I think it has to be, one, family driven. I think you really have to keep the family at the center and not, put your thoughts on what the family should do. Another thing I think we should always start thinking about is really really honoring different cultures. I think a lot of times what I've learned about working with youth and through my experience and through education is realizing that the white culture is very, in a sense, they're motivated by the future. But when you think about Black and brown folks, we are motivated by our legacy. We're motivated by grandma. We're motivated by our community. Those things really motivate us. But a lot of times we engage youth, we often say, forget about grandma, forget about the community that you're from. Think about getting out of here. And to me, a lot of times that doesn't always motivate our youth. I think we need to also think about bringing in the community and the family to whatever we do with you, whatever intervention that we have. So I think, again, for me, at the macro level, is really thinking about, as we learn, hindsight's always 20/20, as we learn from policies, making sure that the next policies that we put in place, that what supportive services are we going to add to that policy, but then also when we think about working with families directly, making sure that we're doing it in a very culturally relevant way.
Wow, thank you for that. I'm trying to think about where I can go with that. I'm going to start out with a little quote I heard that I was remembered recently by George Orwell. And he said, who controls the past controls the future, and who controls the present controls the past. And I bring that up because it makes me think of this phrase that I heard recently called institutional memory. And I'm going to use an analogy that's specific to LA. For some of you that lived in Los Angeles, of course, have been paying attention to LA history, you'll know exactly what I'm talking about. I remember right after the 1992 uprising and riots that happened here in LA, and I remember there was lots of conversations very similar to right now, talking about police reformation. And not that I want to get into talking about police reformation and all of that, but I just want to use it as an analogy. I remember I was sitting in a car wash on Crenshaw, and a little old lady was sitting next to me waiting for her car to get dried at the car wash. And so again, all the conversation was about changing the police, getting new leadership, and then everything would be better. And she leaned over to me and said, it doesn't matter who you put at the head of the organization. It's all the middle management that's going to continue reinforcing the status quo. And so when I say that, I love for all of us to think about institutional memory in terms of how all of our systems work. There's lots of conversations right now about changing leadership, changing people, changing course. But as systems work, there's an institutional memory that helps bring them right back to how they always work, to what's comfortable, to the narratives that people have adopted over and over and over for decades. And the reason why I'm recalling this particular moment, some really interesting news stories came out this past week. I encourage all of you to look them up. The New York Times, they just released a story about some research that was done by the genetic database called 23andMe, and it was exploring the history of childbirth during the period called slavery here in the United States. And what they came up with through their studies, I think over 50,000 African-American people across the United States, that most of the offspring, even though about 60% of all of the Africans that were enslaved, most of the offspring or most of the children were born from white men. And so when you start thinking about the Black family and thinking about how the institutional memory begins with this very low empathy for the Black family, that institutional memory has a through line that goes all the way into our child welfare system. There was another story this week coming out of North Carolina that Black women were sterilized all the way up until 1974 as a method of preventing more Black children from being born and to breed out Black children in the state of North Carolina. That was just this past week. So again, I encourage you to look it up. And again, I think about the low estimation of Black families to even enact a policy and execute it over decades with impunity. And so when I think about those kinds of narratives and thinking about Black families and thinking about Black children, and then you compound it with how we think about poor people, it's real easy to want to take children away out of their homes and place them elsewhere. Because again, that's the institution, that's how it's been working for so long. And so so we have to kind of come to a reckoning. Is it an opportunity for us to reform it, or do we need to change it outright? And I think that's really the parameters of the debate that we need to have. I think one of the things I think, Gary, that we got to be careful about, and you and I talk about this with our colleagues quite a bit, is that as we have these debates, as they're being had across the country right now, we got to make sure that the parameters of the debate are not set by the system, but they're set in a way that allows for all the different variables to be observed and addressed if we're going to really make some self-correction. So I think that on a macro level is what comes to mind. And of course, on a micro level, I'm thinking a lot about all of the young mothers that are in our program right now. And as people are applying for unemployment benefits, and they're going to see cuts possibly this round for the next 13 weeks. And I'm thinking about how hard it is to think about how it is to raise a child, feed them 3 meals a day or more on a very small income. And then at the same time, we place so much blame on them for being in that state in the first place. And so there's so much patience and empathy there we need to grow to have a higher respect for our children, for Black children, and for Black families if we're going to really start to kind of change course. And I know we're flying in time, and so I want to stay with the kind of COVID-19. We were talking the other day about COVID-19 and how it's changed the way we work. Our teams can no longer work one-on-one with families. So we're doing all of our work through computers, through Zooms, through chats and texts and email. We're doing everything to make sure kids are not falling behind in school, doing it all virtually. And I think it's interesting when I think about COVID-19 and how we changed our work. I'd love to hear your thoughts about how your work has become a little different or been reimagined, or have you pivoted during this time? And then I got an interesting take on how COVID-19 is also could be a model for success for us all. And I'll respond after you go.
Yeah, I think for me, right away, I knew because of the compounding factors that our families are already faced when COVID was introduced, that all that stuff would just be, just highlighted and get worse. And so for me, it was like, we need to really step up and make sure the families have the support going into this. And so for us, we used to check in with caregivers twice a month as part of our model, but ever since COVID hit, we're checking in with caregivers eight times a week. And in some cases, we check in with caregivers 4 times a day. And another thing was food insecurity was going to happen. So, for the first time since I've been a part of Friends, we put together a food pantry to make sure that, families had access to the basic needs. Another thing that, happened because everything went to remote learning, tablets, and making sure that kids have the technology. So we kicked in and made sure that kids had the technology. And all this was, with my team and myself, we knew that our families were going to be impacted more than the rest of the population when it comes to COVID. So we knew we had to step our game up as far as the supports that we were giving them during this very, very, unique time in history. So it wasn't a time for us to step away. It was a time for us to lean into the families. And so I'm just proud of my team for doing that, because, they were dealing with their own challenges, but they understood that the families had some very unique challenges that they were dealing with. So that was just really, really good.
Yeah, for sure. No, we've also done a few things very similar. We bought iPads for all of the kids who didn't have computer technology in their homes, as well as purchased some learning platforms to make sure that kids had an opportunity to learn with us and in the sanctity of their own parents and on their own. And we're also added in some new training for our staff. I feel like now more than ever, this is where we all have to continue getting smarter. As this is a new chapter in our history of the world, we also have to keep learning to make sure that we're ready to face whatever challenges come next. And so very similar to you, we've added some of those different components. And of course, I've already alluded to it earlier, we've done a variety of ways to make sure that families stay connected and are getting the essential needs that they need. I know that a lot of corporate partners have really stepped up during this time period to make sure that our families, especially in LA, can remain mobile and be able to access opportunities for food, clothing, and whatever else at a moment's notice. And so I'm really thankful for some of them for their support. I think the other thing, when I think about COVID-19, I think there's an interesting learning moment that we can gain from this. I think all of you, if you recall back in March, when things started to really, there was a really terrible forecast of what was going to come, our larger federal government, I was able to pull together $2.3 trillion to make sure they kept the economy afloat. And when I think about the mass amount of energy that was put into just keeping businesses and this economy afloat, I think that could be a metaphor for how we need to address and to deal with families who come into a state of crisis. Instead of looking at them as that they're somehow inherently not pulling their weight or not following through on their compact as parents. We need to think about how can we pull together all the resources to help them get through tough times. And I think that's possibly the method that we can start to really see families start to grow and thrive. And I'll share a little pop culture note that ties into this. Today, Chance the Rapper was trending on Twitter because he was talking about foster care. And he had mentioned somebody had wrote that they were talking to a public defender. And the public defender says it's a shame that families in the city who are living in poverty have their children taken away from them to be given to another family, and money is given to that family to raise those kids. And so we've got to really start to reevaluate what's the most important and critical element of life. Is it business or is it humanity? And I think that's really what we're in the business of, Gary, is the humanity business, and making sure that that's number one and the focal point of all of the things that we do. And so we are now at that 20-minute mark, like I promised. And I wanted to give some members of this audience a chance to talk to me or Gary, or in general, if you have some questions. So this is your opportunity to either raise your hand or to type something in the chat, and we will call it out and give an opportunity for everybody to be a part of this discussion. We don't have all the answers. We can only arrive at them collectively with your support. So let's take a second for people to pull up and be a part of this. And it looks like we already have one. And this is actually from one of our team members, Elizabeth Wolf, who's one of our friends in LA. And she says, how do we build love into policy? Is it possible to do it in a racist and unjust system? Wow. Well, I have an answer for that. I'm gonna let Gary. Gary, you wanna take that one?
Yeah, I think the second part, I think often we keep building policies for the world we want it to be. And we need to build policies for the world that exists. And we know we live in a very racist society. So the way you show love is to really figure out how you counter that racism. And so our policies need to be built as such. So if you know going into it that certain things are gonna happen, I think you can anticipate, like COVID is a great example. Going into COVID, there's a lot of smart people in the world. You can say, you know what, who's gonna die at a higher rate? Who's gonna catch COVID at a higher rate? It shouldn't be a surprise to people who's gonna catch these things. So if you knew that going into it, you can say, okay, so what are we gonna set aside to give extra support to those people, to show love to those people? And so same type of thing when you think about, I know people are talking about gun policy. We need to do strict gun policy. And to me, I'm scared when I hear that, because I'm like, a lot of people that look like me are going to be locked up on strict gun laws. So going into you putting strict gun laws in place, certain people are going to be disproportionately represented on these gun laws. What type of love are you going to show them? And whether it be job readiness, social supports, whatever it is, and that's how you show love. So I just think we need to stop, kind of living in a Pollyanna, like we're going to end racism tomorrow. It's not going to happen. And so how do we put love on people that we know are going to be disproportionately represented? So that's what I would say to that question.
Yeah. No, I totally agree. I totally agree. And I'll just say just one quick thing is that, I think some would argue that a lot of the laws and policies are built in such a way to be racialized and unjust. And then there are some policies that have unintended racialized outcomes. I think the question is are we able to course correct when we start to see trends that are somehow unfairly, disproportionately affecting certain communities? For example, if you think about the enormous number of people who are Black and brown that are dying from the coronavirus, there's certainly some reasons for us to really reevaluate our so-called healthcare system. And just reading something this morning about a lot of the farm workers throughout our entire breadbasket of California who have to work and who are in close proximity to one another, who don't have the privilege of being able to social distance. they are contracting the coronavirus at a high rate, especially as all of the workers that are working in a lot of these restaurants and markets that we rely on so much, they don't have the luxury of being in their homes and getting on Zooms and doing their business on a day-to-day basis. And those are the ones that are being impacted by this more than others. And I think those are the things where we can need to be observing and seeing how we can course correct. Of course, as human beings, hard to make foolproof anti-racist systems. But if we start to see signs and racialized outcomes, that's where we have to course correct and do it quickly.
Correct.
Yeah. I see some questions still coming in. The next one, more of a statement: people affected by things should be the ones shaping the policies. Any thoughts on that?
Yeah, no, I think we do have to start listening to the people, and I think, or the people that are closest to the work. So I think a lot of times you have people that are very far removed creating policies, and I think that's always a bad formula, because I think those people have blind spots. I do think people that are doing this work, people that live in the communities, are experts for Black and brown things that affect Black and brown people. So I do think, we do have to think about or create ways to lift their voices up and to kind of share that power with them, or it's always going to be, those blind spots are always going to just have really, really bad effects on people's lives for decades if we don't kind of change the way we go about doing things.
Yeah. No, I was going to say on this subject, I think those that are affected by bad policy should be a part of the process. I don't think we should always count on them to come up with the solutions. In fact, I mentioned earlier that the LA County Board of Supervisors are taking up this debate on racial inequality in Los Angeles County. And one of the critiques is to make sure that there is a truth and reconciliation component added into this process to make sure everyone understands who benefits and who doesn't benefit from an unequal system. And that's the only way to really get to all the different elements, because somebody who's being affected by these policies is not going to know how cumbersome and bureaucratic they are. There's so many different pieces and components of it. It's too hard to ask somebody who's impacted by it to figure it all out and then come up with a new one. I think they need to be a part of the process, but they shouldn't be given the charge to fix it on their own. It's everybody's, especially the people that we've tasked and given the power to do that work. I think it's their role to lead it, but to make sure that people's voices who are impacted by it are a part of the process. Any other questions or comments? Well, there may be one or more. I think I want to finish up. We have about 12 minutes to go, Gary. One of the things I like to do when we do these kind of short Zoom webinars to talk about our work, I want to make sure we give people something that they can act on and start making movement with. And so love for you to take a second or two and think about our audience today and and think about the conversations you have with stakeholders that you have in New York and Harlem and Bronx on when they ask you, what can I do? How can I help more, and what can I do better? What would you tell them?
I think during this time, I think we all need to do our own self-reflection, because we all have contributed to the way things are right now. So I think we have to do some self-reflection and dig deep to how maybe our own biases maybe have to contribute to kind of the state of this point of our history. I think the next step is really to go out and really educate yourself and do everything that you can to kind of change that narrative in your head. I think to really be honest about that narrative, because we have the media, you have movies, you have all these things that we're constantly taking in, and those things are putting certain images in our heads. So I think you have to work hard to kind of create a counter panel narrative in your head. And so I think you do have to relearn history. You do have to expose yourself to different things. I think it is so important. So I think working hard in that way. But then also, when you're going out to vote, really look at issues and really look at the issues and how the issues are going to affect race or affect the Black and brown community. I think a lot of times, especially up until the murder of George Floyd, you know, when people said Black Lives Matter, you couldn't really say that like that. You couldn't call out Black and brown. I think people had like this color, you know, they want to be colorblind. But I think really asking yourself, like, how has this policy affected brown and Black people? How will it affect Black and brown people? And really think about that and then vote, you know, accordingly. I think it is so important. So I think really making sure that Black and brown issues are at the top of at the top of whatever you do, I think it is an important piece of it. And then support initiatives that you think that are innovative, like, you know, like Friends of the Children. I think it's so key. I think a lot of times, you know, we vote and we may not think that, you know, given to a smaller nonprofit would do, but I think I learned that from Conrad and Hilton. I think the more we to innovative programs that have the solutions, the better, because I think the government could learn from models like Friends of the Children. So I think those are, you know, I think three key things that people could do.
Absolutely. I will just finish this up with saying that I totally agree with all of those points. I would just add, I agree, you have to begin at home and in your own circles of influence. Think about your family and friends and how they can be evangelized and starting to think about these issues as much as we sometimes think about it. And I'm going to just warn you now, it is exhausting when you think about these issues. But as LeBron James said the other day, that when he thinks about Black Lives Matter, he's thinking about it all the time. It's an everyday thinking. It's a conversation that's being had all the time. It's not just this moment in time. It is constantly until we get to a place where we can all say that we are able to live our freer selves. And so I would encourage starting with self and thinking about these subjects, not just now because we're all stuck at home, and not just now because we see all those images all over the country and the TV that are certainly jarring and inspiring and brings tears to your eyes, to be thinking about it when all of this passes, because it's going to take quite some time for us to really course correct and build the right kind of systems. As Gary mentioned at the very top of this conversation, you know, about a 10 to 15 year process had to take place in New York to shrink that system down to where it is now. So this is not a quick fix kind of issue. And as you see children to start thinking about something that my aunt, who actually is from New York, Dr. Adelaide Sanford, I remember she once told me about the importance of two things. One, be patient with our people, because we never know how much they've gone through and how important that statement is, to be patient because we don't know how much they've suffered. And the other part, which ties into the beauty of the Friends of the Children model, is you can never underestimate the impact that you can have on a child. Those couple of things are the things that animate me, drive me on a daily basis to do my work. And not that they will work for you, but I'd love for you to think about, again, in your own circle of influence, how can you get more people thinking about this, thinking about them constantly, and then also keeping that high level of patience and remembering the great impact that each and every one of us can have on a child. I think that's where we start to make the change that we want to see. So I see one or two more comments that came in here. I will read those and then I will let you go about your day. Latima wrote, I don't have a question, but I truly appreciate this conversation. Hope it isn't the last one. As an org, we are doing a lot of good work, but there's so much work to be done. Thank you, Latima, for sharing that. And of course, Lauren Nichols from the Pritzker Family Foundation, thank you for joining us today. I want to thank all of you for joining us. I see a lot of beautiful faces. Some of you are hiding, but I know you're here. So I will talk to you soon. Gary, thank you again for joining me. I hope we can do this again soon, sir.
Take care, sir. Yep.
Take care, everyone. Bye.